Good afternoon. And thanks, Richard, for giving me the opportunity to talk about a little bit about climate change and health and role of public health. So you have seen this slide in the morning. Climate change is the biggest global health threat of the 21st century. The climate change is the long-term shift in our weather patterns. So we have already heard that it's going to be more warmer temperatures. It's going to be longer and hotter summers. We are going to see more frequent rainfall, more precipitation, floods, thunderstorms. So how it is going to impact the health? This is my most important slide, how it impacts the health, some of the changing weather patterns. So directly, exposure to temperature, extreme cold, increase in other extreme weather events like floods, poor air quality, air pollution, all these leads to many, many illnesses due to extreme heat, cold, injuries during flooding events, and falls during cold weather events. It also impacts us indirectly. There's transmission of infectious diseases, especially when there is food and water contamination, vector-borne diseases. It also leads to decreased food productivity and availability, food shortages, and ultimately moving of the populations, migration of the population from the region. So Windsor, Essex County has already experienced impacts of climate change in recent years, such as rising temperatures. So some of the data that we have seen is between 1941 to 2012, there has been average increase of 1 degree Celsius in our region. 1 to 3% increase per decade from 1970s to 2000 in the rainfall. And we have already heard a number of times that 2016 and 2017 flooding events, which not only were floods, but also led to standing water in our region. Periods of extended heat warnings. Recent years, we have seen heat warnings that are lasting for longer duration. Last 2 years, I have issued heat warnings where we have had it for 5 to 7 days. We are under continuous heat warnings. That has impact on our heat illness. People who do not have air conditioning, that's another big issue during those events. The presence of invasive mosquito species and greater presence of insects that carry diseases not commonly found in our region. We have been the first region in Canada to identify the Aedes aegypti mosquitoes. We have established population of Aedes albopictus since 2016. Both of these mosquitoes are the carriers for Zika, dengue, and chikungunya. So these mosquitoes we were not going to see till 2025. So they came around in 2016. And in this year again, during our monitoring program, we also saw Aedes aegypti again. The other thing that we have seen is increase in number of black-legged tick population. Till 2018, Point Pelee National Park was the endemic region in our area. This year's map that was released by Public Health Ontario showed whole of Windsor, Essex is now endemic for black-legged ticks, which are the carriers for the Lyme disease. We have also seen the presence of Lone Star tick, the bite of which causes the red meat allergy. So what is our role? What are we going to do at the health unit? We are going to assess the health impacts of climate change in our region. We will engage and collaborate with our municipal stakeholders to look at the data to address the local impacts of climate change on health. So the last few years, we have been working very closely with IRCA, City of Windsor, County of Essex, and other municipalities to address the health impacts of climate change. This we have already seen. We have declared, which I'm really happy, we've declared the climate emergency, County of Essex, City of Windsor, and Town of Amherstburg. So what are our next steps? We will be completing and releasing our climate change and health assessment report soon. This report focuses on 6 climate-related health hazards: extreme temperature, extreme weather, air pollution, vector-borne diseases, food and water contamination, and UV radiation. It will focus on the current and future projections for local climate, impacts of climate change on health of our residents, and what actions are already happening. So I'll have a list of the adaptation actions that are already being taken in our region and where the gap exists. This report will help guide municipalities and other agencies in their planning processes. We will also develop and implement a stakeholder and community education and engagement plan. We are looking to work with our partners to develop resources for residents to increase knowledge of local climate change impacts. And our Board of Health also passed the resolution and declared climate change as one of their priority action items for next year. And also for the provincial level, the provincial government announced its first ever multi-sectorial provincial climate impact assessment to start next year, and the final report for that will be released in 2022. Thank you.